Oxygen concentrators are durable and built to last, but like any machine, they will eventually wear out and need to be replaced. Lifespans vary due to factors such as how often they're used and how well they're maintained, but in general, you can expect your portable oxygen concentrator to last around 4 to 7 years. You'll know it's time to replace your machine if the oxygen purity level drops below 80%. At this level, your concentrator is no longer delivering enough oxygen to treat your respiratory illness. Proper service and maintenance help prolong the life of your concentrator. Refer to your user's manual for specific cleaning and maintenance requirements, but here are some general guidelines. Keep your home oxygen concentrator in a well-ventilated area, away from dust, dirt, and debris. Wipe down the outside of your unit at least once per week. Use warm water and mild soap to clean your humidifier bottle before every refill. Know when to clean or replace filters. If you don't frequently use your unit, run it for at least 10 hours per month to ensure the sieve bed stays active. Change your nasal cannula and tubing monthly. Every quarter, run your portable oxygen concentrator battery until it drains, and then fully recharge it. With the proper care, your unit will serve you well for the foreseeable future. If you have any questions about maintaining your specific model, please reach out. Our oxygen experts are ready to help. When you breathe easier, we breathe easier.